are tuned to Radio Imazi, broadcasting from Kigali. Here is the news in English, brought to you by Fiona Umuganwa. The headlines. President Paul Kagame has suspended Edouard Bamporiki from his duties as State Minister in the Ministry of Youth and Culture. Rwandans around the world have petitioned the Speaker of the Legislative Assembly of Queensland, Australia, urging him not to give a platform to genocide deniers there. Chelsea fans have called for a quick, transparent sale. Welcome back. News in detail. President Paul Kagame has suspended Edouard Bamporiki from his duties as State Minister in the Ministry of Youth and Culture, owing to matters of accountability under investigation. Prime Minister Edouard Ngirente said in a statement released this evening. However, the scale of the investigations remains unclear. First Lady of Rwanda, Her Excellency Jeannette Kagame, attended the launch of 13 new medical programs here in Rwanda. This is part of an initiative that will help people in need of medical care to access it easily without traveling abroad. The programs include adult and pediatric cardiology, hepatology, gynecology, oncology, nephrology, endocrinology, maternal-fetal medicine. Others are pediatric surgery, neurology, plastic surgery, dermatology, Master of Science in Clinical Anatomy, and Doctor of Philosophy in Clinical Anatomy. Dr. Patrick Ndimubanzi, Executive Secretary of the Human Resources for Health Program, noted that the number of medical specialists on the ground who are equipped with the necessary skills to adequately respond to such needs remains low.
This level of care has come at such a crucial time, given the number of Rwandans who travel abroad seeking such services. Despite the existing local demand, the number of qualified professionals, medical specialists on the ground, who are equipped with the right skills to adequately respond to such needs is still low. Hence, the necessity to increase their numbers and capacity through these training programs that we are here to launch today. It is this opportunity to remind that this is only the first step of an ambitious journey. Given the gaps in the quality and the quantity of the health workforce, it is of crucial importance to join forces in doing all the possible outreach to attract the necessary resources so as to create a healthcare system that is fit to meet all the needs in the country.
Dr. Daniel Ngamije, the Minister of Health, said the launched programs will contribute to the national strategy of health professionals and have a target to train the next generation.
Your Excellency, First Lady, we are extremely grateful to you for the resource mobilization that we have been undertaking to support the development of the health sector in general and for the national strategy for health professional development in particular. A good example is the support from Susan Thompson Buffett Foundation through Imbuto Foundation to build the maternity at Kabgayi Hospital that will be soon completed and will serve as a teaching hospital for doctors, nurses, and midwives. We sincerely appreciate substantial financial and technical support given by Susan Thompson Buffett Foundation to King Faisal Hospital and to the rest of health system.
The new medical curriculum will be taught in collaboration with the University of Rwanda, the Department of Health Education, a teaching hospital and a partner in the program, Susan Buffett Foundation. The program comes after Butare University Hospital, CHUB, and Rwanda Military Hospital have entered into an agreement with King Faisal Hospital on the transfer of patients to help eliminate the problem of long-standing surgery appointments. Rwandans around the world, including members of IBUCA, the umbrella association of survivors of the 1994 genocide against the Tutsi, have petitioned the Speaker of the Legislative Assembly of Queensland, Australia, urging him not to give a platform to genocide deniers there. In their online petition addressed to Curtis Pitt, Speaker of the Queensland Parliament, the Rwandan Australian community expressed deep concern and strongest objection to the use of the Queensland Parliament Hall by a group who refer to themselves as Rwandan Association of Queensland for the event themed Never Again Annual Rwanda Genocide Commemoration set for Saturday, May 7th. Members of the rogue group are known to be vocal propagating the double genocide theory, a form of genocide denial. Part of the petition notes that their commitment to falsely propagating an alternative narrative that the events of 1994 were not a genocide against the Tutsi, rather a genocide against both Tutsi and Hutu, reflects a clear case of genocide revisionism. The petitioners note that the tacit support for this event, demonstrated by hosting this formal function on the grounds of Queensland Parliament House, reflects a continuation of genocide in the final stage of genocide, which is denial. The petitioners in Australia state unequivocally that there can be no legitimate case for the commemoration on May 7th, and that any effort to do so stands in contravention to the UN resolution, Australia's stated support, and the international consensus reached. Australia is known to have become a den of genocide fugitives, deniers and subversive groups that are against the government of Rwanda. A 3-day conference ongoing in Rubavu district has brought together approximately 200 accountants and economic specialists. The objective is to exchange ideas on economic development and how to boost it in the district, which has been severely affected by the shockwave of the COVID-19 pandemic. Stella Simiyu, Chief Operating Officer at Sentinel Africa, points out that the conference aims to enhance sustainability and resilience, especially in the digital world.
So this symposium is discussing pertinent issues regarding how to enhance sustainability, how to enhance resilience, especially in a digital world. We are discussing very important topics of post, especially COVID, and as we gain recovery, how do we then pick up the lessons learned? How do we incorporate them in the way we work? And how do we as accountants and other professionals then enable our businesses to do much better?
An emphasis was made that financial experts and accountants have an important role in reviving the economy of the level that was hindered by the pandemic, especially if the existing funds are allocated towards upgrading basic infrastructure.
Concerning this, the post-COVID resilience, what we're expecting is that we want to raise awareness for our members who are CPAs, who are helping different organizations to mitigate the impact. One, we are trying to show them the extent to which this pandemic has affected the economy. And then we discuss also the strategies that can be used to help companies recover faster. People can even share experiences because we know different sectors are experiencing this situation differently, but the people can always compare notes and then they see what they can do.
Rwanda currently has 800 professional accountants and 5,000 accounting students. The United Nations Population Fund Rwanda joined the Rwanda Association of Midwives and other partners to celebrate the International Day of the Midwife and Nurses. International Day of the Midwife is celebrated every year on May 5th, providing the opportunity to honor the work of midwives and promote awareness of the crucial care that midwives provide to mothers and newborns. Both private and government hospitals and clinics participated in recognizing the nurses and midwives. The nurses and midwives enjoyed their day. However, they expressed concern and requested of increasing their number in practice. As much as their profession is a call to serve the community, they need to be motivated to provide quality service through provision of more of their number and increased salary and improving of other working conditions. Dr. Corneille Ntihabose, the head of clinical and public health services at the Ministry of Health, promised to continue working with other leaders to advocate for an increase in the number of nurses and midwives.
Some items of international news on Radio Imanzi.
Welcome back. Food is fundamental to the efforts to tackle climate change, according to a scientist who has spent decades tracing the interactions between global warming and what we eat. Cynthia Rosenbrick, head of the Climate Impact Group at NASA Goddard Institute for Space Studies, was awarded today the prestigious World Food Prize for her research. That includes stark warnings about the potential effect climate change will have on food. She noted that climate change cannot be restrained without attention to greenhouse gas emissions from food systems. The work, among others, shows that those food system emissions are approximately 1/3 of total human emissions. The world is not going to be able to solve climate change unless these are taken into account. The trial of Senegalese midwives accused of neglecting a mother who died during labor resumed today. 6 health workers were charged in April with failure to assist a person in danger. The case has prompted enormous outrage in the West African country, where health workers are often accused of extorting patients, misconduct and negligence. The victim, Astu Sona, allegedly waited hours for medical attention before she passed at a regional hospital in northwestern Senegal. Since then, patient rights organizations have been overwhelmed by complaints, testimonies and petitions against health workers, especially those in the countryside. Diplomats are saying that hope is slowly fading that the 8 workers, including a Tanzanian, trapped inside a flooded mine in Burkina Faso, will be rescued alive. The 8 have been trapped for 2 weeks at the Pekoa zinc mine. Dr. Benson Bana, Tanzania's High Commissioner to Nigeria and the entire economic community of West African states, said the rescuing mission was still ongoing. He says rainwater began filling the mine when the workers were 500 meters below the ground. Spain's top spy master was grilled behind closed doors by lawmakers today over mobile phone hacking revelations that have roiled the country's fragile coalition government. Paz Esteban, the first woman to head Spain's CNI intelligence agency, appeared before a parliamentary committee for questioning over the affair, which has dominated headlines for days. Jamaican sprint queen Shelly Ann Fraser-Pryce, who has 9 world titles to her name, will be competing in the 100-meter in the Continental Gold Tour event at Kasarani. Fraser-Pryce said the push for her Kenyan fans on her Facebook page lured her to compete at this year's Absa Cape Kino Classic. The 35-year-old Fraser-Pryce, who promised to give her Kenyans fans what they requested for, said Jamaicans who are known for sprints love going to countries that embrace and support them. Chelsea fans have warned that the sale of the club must happen swiftly and transparently to avoid putting the club in existential danger. The Chelsea Supporters Trust said it had held a meeting with the representatives of Jim Ratcliffe, the British billionaire who tabled a last-ditch €4.25 billion bid for the club last Friday. According to Tom Crotty, a director of his petrochemicals company Ineos, Ratcliffe's offer came weeks after the deadline for interested parties to submit their bids to American bank Rain, who are overseeing the sale process, and has been rejected out of hand.
Economic news is a regular feature on Radio Imanzi.
Moving on ahead with the Rwanda Stock Exchange Market Report. The trading session recorded a total turnover of 10,863,000 Rwandan francs from 42,600 shares traded in one deal on the equities market and 1,044,600 Rwandan francs worth of bonds traded in one deal on the fixed income market. Bank of Kigali closed the counter at 255 Rwandan francs. The trading session recorded a total turnover of 10,863,000 Rwandan francs from 42,600 shares traded in one deal. Bralirwa closed the counter at 155 Rwandan francs. I&M Bank counter closed at 43 Rwandan francs. Simerwa at 120 Rwandan francs, M10 Rwanda at 179 Rwandan francs, Equity Bank at 440 Rwandan francs, Kenya Commercial Bank at 370 Rwandan francs, National Media Group at 1,200 Rwandan francs, Uchuri Supermarket at 104 Rwandan francs, and RH Buffalo closed the counter at 526 Rwandan francs. The currency market review of today. The Kenyan shilling buying price was 8.7 Rwandan francs. The selling price was 8.8 Rwandan francs. Tanzanian shilling buying price was 0.43 Rwandan francs and the selling price was 0.44 Rwandan francs. Ugandan shilling buying price was 0.28 Rwandan francs and the selling price was 0.29 Rwandan francs. Burundian franc buying price was 0.49 Rwandan francs, and the selling price was 0.5 Rwandan francs. The US dollar buying price was 1,010 Rwandan francs, and the selling price was 1,030 Rwandan francs. The British pound buying price was 1,267 Rwandan francs, and the selling price was 1,293 Rwandan francs. The euro buying price was 1,071 Rwandan francs, and the selling price was 1,093 Rwandan francs. With that, we come to the end of tonight's edition.